We are closing with two incredible leaders in healthcare at the national level. So you've had the opportunity to hear from a lot of folks from Indiana and around the country. But these two women have just really been a powerful voice for transparency and how to really align payment with the value of services throughout the country. So I thought it would be great if they could kind of share their perspectives. You know, we have transparency. What are we going to do about it? We've heard some ideas. We didn't all agree, and that's okay. At least we're having honest conversations. I'm excited about that. My expectation, my bar's low. I just want honest conversations, and that's a great place to start. So it's really my pleasure to introduce to you Suzanne Delbanco. Suzanne and I have known each other quite some years now. I actually met her at a conference in DC and just fell in love, so I just have been stalking her since. She actually is the executive director of Catalyst for Payment Reform. She is the website. I mean, we use their tools. So she's a healthcare. I should probably read her bio, but. All right, I'll read it. Suzanne Delbanco is the Executive Director of Catalyst for Payment Reform. In addition to her duties at CPR, Suzanne serves as the advisory board for the Source on Healthcare Price and Competition at UC Hastings. If you guys have not been to that website, I'm going to read it again because it's really awesome. The Source on Healthcare Price and Competition. Katie Goodixon, if you're out there, hello. She is she works there as well, and they have all these laws on anti-competitive language. So if you're thinking, hey, what policy ideas are there, and which states have done it, and could I get those bills? You just go to this website, and they have all that great information, including on APCDs and a whole bunch of other things. So a great resource. Suzanne's actually been, I'm going to go off script again. So Suzanne, she started Leapfrog, so she's been in the quality space since 2000, I mean, that's a long time just to be in the quality space. But Leapfrog, we heard a little bit about it earlier, and she's not at Leapfrog now, she's at CPR, but they've just been developing, they talk to all the stakeholders, really trying to figure out this space. So I'm very, very much looking forward to your thoughts and ideas on where we go from here. Okay, so it was a tough call to say who was going to close us out, but Cynthia Fisher is going to close us out, and I recently met Cynthia through a colleague, and I have just been so impressed with her. So when we talk about the federal price transparency rules, where hospitals have to post their prices on their websites starting January 1st, 2021, guess whose idea it was, and guess who made it happen? It was Cynthia Fisher. It's remarkable, and I think when I meet Cynthia, it's just the power of one. It's just one person. You think there's no way. It's so complex. It's crazy. We can't get it done. How am I going to do it? You can do it. We all have to do it. We will do it. So I'm doing my little part. Cynthia's done her big part, and then all of us will figure out kind of like, where we're going from here. So with no further ado, Suzanne, you're up.
Thank you, Gloria. I love that you said you started stalking me, because I feel like I started stalking you. And I felt like it was meant to be, because my husband's first name is Sach, and his sister's name is Davy. So Sach Dev, I was like, we're meant to be, and we're part of the same family. Anyway, it's really exciting to be here. When I reflect back on the last 2 decades of my career, we have come a long way. We've come a long way in the sense that, 22 years ago, there was no public reporting on quality. There was no public reporting on price. And here we are, not just talking about, could we make that part of the healthcare system, but how can we use it? That's huge, to think about that accomplishment. On the other hand, 22 years to get here, how frustrating is that? So one of the things I'm hoping for is that we can leapfrog, catalyze, make some faster progress than we have been making. So for those of you who are not familiar with my current organization, Catalyst for Payment Reform, I just want to give you a tiny bit of background, and then we'll get into the substance. Catalyst for Payment Reform has been around 12 years now. We provide thought leadership to, and care coordination, oh my gosh, too many conversations today. I'll start again. We provide thought leadership to and coordination among employers and other healthcare purchasers who want to get better value for their healthcare spending. And as our name suggests, we started out trying to catalyze payment reform, changing how we pay for healthcare. We felt that was an underutilized lever for trying to improve quality and affordability. But as soon as you're trying to improve the value equation, you have to get into other areas like benefit design, provider network designs, and both of those really require transparency. You can't do that without understanding the quality and the prices of different providers. And then you also kind of have to get into the provider landscape and what's been happening around all the consolidation and market power and what that does to the balance of power out there in the marketplace. Because even if you have transparency, if certain players in the marketplace have the market power, they can say, yeah, you know this about me, but I'm not going to change because I don't have to. So we get into all those different things. And we do have a membership, as you can see. It's quite diverse. We have household name companies. We have a famous university from Indiana as part of our membership. And we also have multi-employer union trust funds, state Medicaid, and employee and retiree agencies. What all these purchasers have in common is that they tend to be among the most innovative, the most bold, the most willing to try new things. And so they come together with us. We set a shared agenda for change. And then we try to make it as easy as possible for them to implement that change, as well as all the other purchasers that follow us. So we're a 501c3. Just like Gloria, we make most of our tools available for free in the public domain for people to use because we have a mission and we don't want to erect any barriers to that mission. We've been tackling tough challenges now for over a decade. And I wish I could say, looking back, that the public reporting on quality, changes to how we pay doctors and hospitals have gotten us to the place where we want to be. I wish we could say that quality is significantly better, that safety in hospitals is significantly better, and that care is more affordable. I don't think I can say that. One of the things, though, that keeps me going is I like to think, although I have no way of proving this, that the healthcare system would have been far worse had we not done what we've done. So we go about trying to execute this change in a variety of ways. We spend probably about 60% of our time helping purchasers become better at what they do. And we spend about, depending on the day, a third to a half of our time conducting research, analyses, putting out report cards, scorecards to hold the healthcare system accountable and track its progress. So we created the first ever national scorecards on payment reform. We've done report cards on state laws impacting price transparency and things like that. So, when I talk about wishing that we could declare some victory, this slide feels particularly personal to me right now. This came from the American Enterprise Institute, but I just loved what it displayed because I am the mother of someone who's about to go to college. And you look at how expensive college is, and everyone agrees it's broken. This is insane. Not only have you heard about all the college admissions scandals that are happening, but I have a cousin who she and her husband are both professionals, but they happen to be in do-good professions where they don't earn very much money. Their daughter couldn't apply early decision to colleges because you don't know what your financial aid is going to be when you apply early decision and you're bound to go to that college. So she didn't have the advantage of a higher admissions rate, of getting into good schools because she couldn't commit to paying whatever they wanted her to pay because college is so expensive. And when I think about my bright nieces and how she couldn't apply early like other rich kids can, it just makes me go crazy. And yet here you can see how much college prices have risen. What's worse? Hospital prices. So, wow. Okay, so this is personal for me. Another very personal experience that I had spells out a slide that you saw earlier about how as healthcare costs rise, our wages are getting eroded because more and more of our compensation is going to healthcare. So I have a story I can share with you. I had a bright young employee who was a year out of college. Her first year of working for me, she had done a very nice job, so I was pleased to give her a good performance review and a raise. And we do those performance reviews at the end of the year, right around the time we get, those quotes on what our premiums are going to be the next year. And literally within 2 weeks, I said, great job, and I gave her a raise, and 2 weeks later, her take-home pay was less than it had been 2 weeks earlier. Because I gave her a 4% raise, but the healthcare costs went up 18%, and that was enough to cut into the raise that I had just given her, and I felt like crap. I'm like, congratulations, sorry, all in one sentence. And so, this is really real, and that was just an example of someone. I know I live in an absurdly expensive part of the country, but she was trying to pay rent in San Francisco, and it made it really hard, when she was counting on that take-home pay to be able to cover that rent and her other living expenses. And the other thing I can say, if anyone else out here is a parent, especially a parent of kids in public schools, I'm so sick to death of bake sales. I mean, I like baking. My boys and I have a lot of fun making our snickerdoodles, and we've gotten it down. And we know exactly where to go in Berkeley on what weekends of the year to get the biggest bang for our bake sales. We know don't price things out. Just tell people pay whatever you feel is appropriate, and people will give you much more money than if you price the cookies. So we've gotten it down, but the fact that I have to go out there and raise money for stuff related to basic education is in part because in the San Francisco Bay Area, I live in a place where there's huge consolidation. We pay 50% more for healthcare than they do in Los Angeles, where there's competition. And this means I have to be out on weekends raising money for public schools when I wish my taxpayer dollars were able to go more to paying for education than getting sucked up by healthcare. Now, I mean, all of us will agree healthcare is incredibly important, but is it 20% of GDP important? I mean, obviously you can't do anything if you don't have your health, but education's important, infrastructure is important, all these other things, and we're having to shift more and more money to healthcare. So, I wish I could say by evidence that we can solve this problem through employers. Now, the members of CPR, some of the employers in this room are incredibly innovative and are doing really great things and helping their own companies save money. But you are the few and far between. Most employers, as you heard mentioned earlier today, do not have the sophistication, the know-how, the bandwidth on their teams to digest all this information and feel capable sitting across the table, either from their contracted health plan, their consultant, or maybe if they're bold enough, a provider, and have a discussion that enables them to do better for their own employees, much less start shaping the healthcare system to be higher functioning for those of us who use and pay for care. So, we've seen innovative benefit designs that got mentioned earlier today, reference pricing, changes in cost sharing to create incentives for consumers or patients to seek the high value providers. We know about provider network designs where if you just cut out those 10% most expensive, you could bring down the cost of premiums and you could help people get to higher value care much more easily without too much homework on their part. We heard some exciting stuff about, community hospital direct contracting with 200 employers. That's really amazing to hear because most employers say, I don't have the bandwidth to do that. And we know that provider payment reform can be successful in certain circumstances, but the details matter, and some employers have really embraced that, especially around centers of excellence programs that they've put into place. And in a very few markets, we've seen employers band together and be very successful at aggregated purchasing, buying in bulk in order to get better value for their populations. But these are such rare examples. Most employers don't get involved in this at all. They just get the bill each year. They want to pull their hair out, but they don't know what else to do besides pay it. So, what are we going to do to try to, when we think about where to go from here? One of my theories of change, whether at the Leapfrog Group or Catalyst for Payment Reform, is you don't necessarily need every employer to do the right thing. If you can at least assemble the biggest customers of the biggest health plans and have them demand change, you can create some change. And that's in fact how we've gone from 3% of payment being tied to performance to about 60% today. because the big employers and CPR push the bukas, as people like to call them, to speed up what they were doing around payment reform. So it can happen, but it is not easy to create that kind of change. And we have been here all day talking about price transparency and the need for it, how it can be used. So it's amazing what Cynthia accomplished. It's amazing that we have as much transparency as we do at the state level in some states, now at the federal level. But there's a whole other war going on I just wanted to raise, which is also really important. And pardon anyone who gets offended at this, but health insurance companies, health plans, carriers have gotten more and more stingy about letting their employer customers use their own data, either to understand what's happening in their own populations, to evaluate their own programs, or to give that data to another business associate, maybe a care navigation company or a data warehouse. It has gotten harder and harder for employers to use their own data to control and improve their healthcare programs. So in addition to shining a spotlight on laws and policies that can enhance price transparency, there is a need among private sector companies to get to a better place for those of us, again, who use and pay for healthcare. So we just, after a year-long effort of talking to multiple stakeholders around this topic, we have launched a campaign to try to push for greater transparency of claims data and other kinds of data for employers themselves. And so we talk about data ownership and access, how employers are allowed to use that data, how timely that data is, how accurate it is, and their ability to share it with other business associates. I just want to invite all of you to become part of this campaign and just share that we hear every excuse under the sun why employers can't have these data or why they can't be presented in the way that are useful to them. It's very frustrating. But we have created some tools, again, for employers and other healthcare purchasers, free to download from our website, that can help you with asking the right questions of your health plans, contracting with your health plans, negotiating with them, and making sure that your business associates are able to get the data they need in order to serve your patient populations better. So posting prices is going to be very helpful and will help fill in some of the blanks that employers are not getting through their health plans. But there are other aspects of the data that the health plans are critical for, and it's going to be really important for employers to make sure they don't get into contracts that really keep them from being able to understand exactly where their money is going and how it's being used, et cetera. But even if an employer is able to get their own data, as anyone here knows who's taken any statistics classes, the sample size matters, right? So in order to get a full view of a healthcare provider or a service, you really need more data than just what your employee population has experienced. And that's why it's so important that studies like the RAND study are done, and why it's so important that all payer claims databases at the state level, or maybe one day at the federal level, pool data together to give us a bigger understanding of how well a physician practice is performing, or even a hospital is performing, because we need to pool all the data together to get that complete picture. So how do we make that happen? And how do we get ourselves out of this situation where prices just keep going up, even if it's public knowledge? Again, a hospital that commands power is just going to say, yeah, I know my prices are high, but what are you going to do about it? You don't have another choice of where to go, or my reputation precedes me, or whatever it is that keeps that hospital able to keep those prices high. So again, I'd like to think that employers could be smart enough, band together, that their purchasing practices alone could generate the competition we need to bring prices down. But so few use narrow networks, so few use centers of excellence, so few use tiered networks, or any of these tools that really could generate that price competition. And so without it, we may have to resort to policy. And most private companies don't like the idea of regulation because of the slippery slope argument. Ooh, if I insist that hospital prices get capped in some way, then government could turn around and regulate my business, and I don't want that to happen. But on a global scale, if we are losing our ability to become competitive because healthcare prices are eroding, the viability of American companies, this is something that we have to address. So I think there may be some situations where we have to admit that the marketplace is not functioning as a healthy marketplace, and that we might need some, running rules to guide that marketplace to be, healthier and higher functioning, and that can be in the form of policy. So there's, myriad policies out there that can either address prices directly or enhance competition, et cetera. And some examples were already mentioned today. There are several states that have banned now anti-competitive practices in contracting between hospitals and health plans, as an example. Rhode Island has been a long shining example now over the last handful of years of a state where the insurance commissioner was given greater power in the review of rate increases and is able to cap the percent increase each year in what plans can pay providers. Now, Rhode Island is a state where there's incredible consolidation. And so one of the ways to rebalance the power there was to basically put into law that health plans couldn't raise their prices that much year over year, and that way hospitals know no matter what they demand, it will be against the law for the price to go up too much. So those are just a couple concrete examples. So we right now, with support from Arnold Ventures, like many others here today, are engaging in a super fun and engaging project, which is looking at the different laws that are out there at the state level that are trying to make the marketplace work better. And, for whatever organic reasons, Massachusetts might have a law around, banning anti-competitive behavior, and Rhode Island happens to have a law, capping the increases in payment that a health plan can make to a provider year over year. Every state has taken a different approach. Some states have done nothing. But what hasn't been done before is thinking about a complete policy agenda. If you were a state legislature and you could put a suite of laws into place that together could make the market work better, what would that suite be? And what's likely to function well in a state that isn't too much of a fan of regulation versus a state that's a pretty high fan of regulation? What are the menus you could choose from, and what might those menus look like? And that's what we're working on now with the help of 15 superb expert advisors. And what we will do when we're done with this exercise is to then start educating employers and their government affairs people about, if these policies come forth in your state, should you advocate for them? Should you argue against them? Should you support them if there's this other policy that is necessary to go alongside with it? So we're starting to help employers understand that in some cases, having policies in place might be helpful. So the question again is, where do we go from here? We have done a great job over the last 2 decades of laying foundations for a better healthcare system. We have standard measures, we have public reporting on those performance measures, we have payment increasingly tied to performance, we have public information on prices. But it's all useless if it doesn't ultimately lead to higher quality and more affordable care. And so what we have to keep figuring out is, in this incredibly adaptive healthcare system of ours that, as soon as we push over here, expands over here, how do we create a regime, an agenda that gets it to focus on the right things, on the patient, getting high quality, affordable care, in the way that they need it, in a way that not only makes their health better, but also makes their lives not a misery and try to get through the process of being sick or needing that health care. And so we still have a long way to go. I think voluntary efforts will go so far, But as I know from voluntary reporting at Leapfrog and voluntary contribution of data to the RAND studies, at some point this stuff has to become mandatory. And so with that, it's a perfect opportunity to turn it over to Cynthia and talk about what she has done in that space and other things.
Thank you, Gloria and Kristen. Wow, what a pleasure to be here today. My heart is full to be in the presence of all of you that seek the truth and the truth through transparency to deliver a far better healthcare system for our country as citizen patriots, where you all know that we can have a simpler healthcare system through price discovery, quality transparency, empowering patients and employers, all purchasers and payers of healthcare, to be able to have the best quality of care at the best possible price. But I want to thank you all as fellow travelers who wake up on the side of the angels. So thank you, and keep up the great work. And this issue of healthcare price transparency was not something that I just alone did. And thank you, Gloria, for the shout out. But it's been a team, and I'm so lucky to work with an incredible team of brilliant lawyers, brilliant fellow travelers that look at all aspects of research and analytics. And my goodness, what great work we saw today from all of you presenters that are really changing the game for the better. So thank you. Looking back at why, and how did I get to go to Washington to work on this issue so critical to every single one of us? Well, it's because everyone has a story. How many of you, either yourselves or a loved one or a friend, have been overcharged or faced medical bills far beyond your capacity or what you ever expected to pay? This is happening every single day across our country. And it was a moment of time, March, over 6 years ago, where several people coincidentally came to me during that month seeking help. Now, having been an entrepreneur and a CEO over 30 years ago in the biotech and healthcare space, I had many people come looking for how to get access to a great oncologist or to a great doc to take care of themselves. But in that moment of time, these were working people, 3 separate stories that broke them. Our healthcare system broke them. One was a friend with breast cancer who $9,000 of overcharges put her into total financial ruin, where she lost her home. I helped her move out of her home. I helped her file personal bankruptcy. A week later, my handyman had a $6,000 out-of-network bill from an anesthesiologist, and with huge alligator tears came to me to borrow money after 28 years of knowing me, embarrassed, humiliated, because he was going to have to take his junior out of Catholic school because they didn't have the money. And then finally, it was a nurse at Mass General who came to me to write a check and help support a $38,000 GoFundMe account because her own hospital recommended a modality of therapy that they would not pay for with their plan. I thought, not Houston, we have a problem. Washington, we have a problem. Well, the thing is that I knew from growing up in my career first at IBM, automating hospitals and insurance companies to actually communicate. I'm old. They used to send tapes to each other for their financial services, and I helped them actually network many, many years ago, as well as work in defense logistics. I knew any innovation in any other market sector where the market is functional and consumers know prices and consumers know quality differences, that the industries all have to compete. And there was only one industry
where both hospitals and insurance companies and all the middle players and big pharma, they don't have to compete, because when you don't know prices, they can charge whatever they want. And how do you have remedy and recourse if you never knew the price to begin with? But in innovation in a market sector that actually functions, look at what we all have and use in our lives. I started my career at 22 years old selling these systems and software. And I remember putting in my big briefcase, I used to carry a briefcase back then, a check for over $2 million for that system and software services to automate these hospitals and insurance companies. The power of that computer is right here today in just a couple of $100s for all of us. There is no reason why healthcare can't function the same way that every new product, drug, or service should be able to compete for our business based on better quality, better price, at a lower cost to society. I know it can be done. So what did I do on that day? I decided to put all of my entrepreneurial business interests aside, because I knew this can be done. Because over 30 years ago, we as a team with my Viacord business, which actually started here in Indiana, so it's sort of 30 years ago, Dr. Hal Broxmeyer at Indiana University proposed that cord blood stem cells could be used as an alternative to bone marrow. We took his idea and his brilliant research, and we made it reality. And how do we make it reality? Just like this. We were able to deliver, through quality transparency of collections, outcome transparency of every transplant we ever did, and price transparency for every product collected service that we did, enable broad access across the globe to any family having a baby to be able to bank their cord blood stem cells. And we financially guaranteed that the storage of those stem cells that had life-saving potential to treat and cure leukemia, treat and cure certain genetic disorders, and thank you, God, because as of this year, we finally got it published that not only was leukemia cured, but also HIV cured with cord blood stem cells, at a far lower cost by tens of thousands of dollars than bone marrow as an alternative, and we did it at 1/6 the price of our competitive nonprofit hospitals. So I know it could be done because we did it, and it still exists today. My business, I sold it, and I'm lucky enough to have taken the philanthropy efforts because I still was able to make a profit, still be able to make a successful business that exists today, 30 years later. But now I can spend this time advocating and taking the voice of the voiceless to Washington. And missing at the table of all the lawyers and lobbyists in Washington, D.C. is you all, and all of your families, and all of your friends, the consumers, and the patients. And so I'm a storyteller. I get to tell your stories. But the other thing I got to do is take a film crew with me across the country after doing extensive market research and polling, and be able to film the stories and take it into the White House. But in addition to that, we were able to hire fantastic legal counsel that was able to find, goodness, there's got to be somewhere in existing law the ability for all of us who pay for our health care to be able to make better decisions by being able to know the truth. What is the truth of price? What is the price differential? And what is the quality difference? And guess what? It was an existing law, sitting dormant. It was in several laws that we all have the right to know prices in advance of our care. We found several big 800 guerrilla laws that were never made into rule of law. Now, we went down in the Obama administration, and one of the most powerful laws was the Affordable Care Act that gave us this right. Hence the hospital price transparency rule that came out in January 1st, 2021. The second law that sat, big 800-pound gorilla, is spoken about much today, is the ERISA law, in place since the late 40s. Yes, and retirement funds, when the brokerage fees and all of the financial services industry's actual fees had to be known, what happened? It was a race to the bottom for the consumer in Chuck Schwab, Vanguard, no brokerage fees, no load, index funds got created. And what happened? Because of the class action lawsuits back in the year 2000 in ERISA law, we all in retirement funds now know fees. And consumers have benefited because they have to compete, and they have to compete on performance, which is quality. So this is the new world. It's transparency is transformative. It is truly transformative because it shifts the power. You know, it shifts the power from the back rooms where the deals between the insurance companies and the many middle players that have been capitalizing on each patient's misfortune, maximizing their profits through revenue cycle optimization. And revenue cycle has run amok. The revenue cycle optimization over delivering the best quality of care at the best price and shifting our care to preventative care, that people can know that they can go and afford care in a very simple way and take care of their health in a much earlier time than delaying it for fear of financial ruin. In fact, if the hospitals and the insurance companies, and thank you for being here today, if you all look at a new world of a competitive model of what you can deliver, 64% of Americans delay care for fear of financial ruin because they have been burnt, because they have had their stories. If you think about the opportunity of competing on price and quality and attracting the 64% of white space that's out there as a total market that's sitting in the wings to actually advance preventatively take care of our care, you're going to get the woman in who's going to be able to trust that mammogram is not going to upcode her as the diagnostic, even though she didn't have anything, and forever upcode her at $1,500 when she thought she was getting a free screening. So then she will go get the mammograms she needs instead of delaying that for 8 years and showing up with stage 3 cancer. This is what it takes to do the right thing. So again, I thank you all as fellow travelers for doing the right thing. And what I'd like to show with you is some of the stories I got to take to Washington, because it's not only the existing laws that give us this right, but it was the innovators that were out there changing the game, all of you and all of those employers that have actually done it by the numbers. Marilyn, I know you love math. And, you know, we've pulled this time and time again from Obama to President Trump to President Biden. And all three presidents agree on price transparency as something they all support. But the beautiful thing is it is a 92% issue of the voters going into this midterm election. 92% by President Biden's pollster want all hospitals, insurance companies, doctors, providers, everywhere we get healthcare to be price transparent. 90% of them want actual prices in advance of care to be binding. Right, Chris? And they want the bills to actually match those binding prices. Now, I know it can be done because we did it. And whether somebody gave birth in Singapore or they gave birth next to our lab in Cincinnati, there's wide variable costs, just like the airlines, wide variable costs. But we could price it for what the 80-20 rule was going to provide us, or the 95-5. These variable costs can be priced. So let me show you what's happening and the stories I took in through film to the White House to bring your voices and the innovators forward. And I'm going to encourage all of you to keep going, because as Simon Sinek says, we need just not the early adapters like us, but when Gloria has this meeting in the future, we're going to fill an auditorium, because it only takes 15 to 18% of a populace to shift innovative change. We don't need 50% of the country to come on board. We need 15 to 18%, and we can do it. But let me show you the very people that did it and why we're here.
All I heard is, I need this surgery, it's pretty much life and death, but he never said $101,000. And he never said, oh, by the way, I don't accept your health care.
You don't know any prices.
Until weeks later when they send you the bill.
As if it's not bad enough to think your child might die, but to worry about how you're going to pay for it.
Am I taking care of my family, or am I going to go pay a copay so I can go to therapy? Well, I pick my family.
How many people have avoided healthcare because their first thought is, what's it going to cost?
When you don't have to justify the price that you're spending because it's a secret to everybody, you can charge whatever you want. And without transparency, there's always going to be that variability.
He hears the debt collectors calling the house. He knows his dad's sick. I'd like for this to be taken care of so that my son doesn't have to deal with it.
We probably wouldn't have any customers if they didn't know what they were paying until they got to the cash register.
We decided we should post all of our prices online. We have changed our pricing on our website 4 times, and in each instance have lowered the prices.
When I cut out all the bureaucracy, I'm going to pay hundreds, if not thousands of dollars less than I would have otherwise going through this insurance company, which denied my care anyway.
How do my prices compare, say, to a not-for-profit hospital here in this area? And invariably, the ratio is 6 or 8 to 1. We had a patient from Georgia that was quoted $40,000 for a procedure on our website listed at $3,600. The patient used our price to leverage a better deal. They actually matched our price in Georgia.
The closest I got 2 ballparks. One was 15 to 25,000, and the other one was 30 to 45,000. I go to Texas Free Market Surgery. The tympanoplasty was listed at $5,000 on their website, and I was blown away. This is the solution for driving down healthcare costs for everybody. It's working for my family.
Patients thinking like consumers is what will actually transform the healthcare system, will drive down costs, and will actually improve health outcomes for everybody.
We've taken the outside of healthcare and said, you know what, we're going to blow this up and make it transparent, and our clients have achieved the savings.
We're cutting out the insurance carriers, we're cutting out the networks, and we're going directly to the hospitals and the providers and getting the best price possible.
To be able to know that I was able to have this procedure and it not cost me a penny and save $5,000 was a huge relief to me.
Think of a knee replacement. Our average cost is $20,000. Somebody comes through us, they don't pay their out-of-pocket. Maybe they have a $3,000, $5,000, $6,000 deductible or higher. And if it's 10% of the charge, they get a $2,000 taxable bonus. Put money back in an employee's pocket, that's a mortgage payment. That's a utility bill. That's food on the table. That's real.
Actually, I went to apply for Medicare, and the Medicare guy that brokered it told me that my plan was better than what he could offer me.
Direct primary care, what it does through its transparency and the time we can spend with the patients, once we remove the third parties from the exam room, we give them affordability through complete 100% transparency.
We lowered our cost by 3x, at the same time lowering the team members' cost by over $3,000.
I can look at 4 procedures that save this company $100,000.
Almost a 50% reduction in the cost per employee per month, so I'm getting better results from the medical side, but I'm also, from a cost containment side, significantly better.
So it's a win-win. The employers are saving money, the employees are getting actually better benefits.
I think we'll have a healthier population because they will go to that doctor rather than put it off because of cost.
Let's get this down into a world of reality instead of some make-believe number that has been inflated and conflated over the years to the point that we all think it's truth.
Over the last 10 months, we've saved our taxpayers just over $500,000, which is money that we don't have to go out for a tax increase for.
Ashtabula Area City Schools is the 8th poorest school district in the state of Ohio, and union leaders started to nod their head and say, yes, absolutely, we want better benefits and, zero deductibles, zero co-insurance. The plan got better, a direct primary care doctor, a community pharmacy. We took back health care, over $2.4 million in savings in the very first year.
They've saved $30 million in 2 years, $1.5 million just in imaging.
And somebody in the audience said, we closed a school this year. That $1.5 million would have kept that school in our district open. They're getting the health care that they couldn't afford.
I was recruited by the state of Montana to take over the state employee health plan with the sole goal of turning it around financially. Saved $121 million, and how we did it was putting in the reference-based pricing contracts from the hospitals, changing the pharmacy benefit. We enhanced primary care. We managed it, and they got pay raises. We didn't need any legislation to do what we did. We just went out and contracted with the right parties. There's nothing to stop any public employee health plan from doing this.
The way that you would think in an ideal world, this is how this should work, that's what's happening.
Don't let the hospitals hide. Don't let the insurance companies hide. They're fleecing our country, and it's just not right.
Thank you.
Thank you. I ask you to join us all together as citizen patriots to help our country go from where we are today, paying the highest amount for health care, and our mortality rate's been going down every single year. And guess what? Singapore is just stellar. If you ever want to watch Steve Forbes' podcast, they adopted our system from the 60s and 70s. But if you look at it, since 1960, the quality of our health care has gone down, while the blue line, the price have gone up. So we had heard several times today, in healthcare, we don't have correlation to price and quality. But this can all change. And if we look at nearly $4 trillion of our dollars, one in every five days, we all work just to pay for healthcare at now nearly 20% of GDP. So as a country, how can we as companies, and this is an employers forum, and I'm going to close on this, is unless we employers take the bull by the horns and call back what we need and utilize this unique moment in time of inflation. Our country is most concerned about inflation. We can't control China and supply chain. We can't control what goes on at the gas pump. But as employers, the third thing of biggest concern for our citizenry is the cost of healthcare. And the one place we can control it is in the math. Like Maryland did, run it by the numbers. And now with the transparency and coverage rules, we have to, it's our duty, our fiduciary duty to get these numbers. And so this is what I would leave you with, is every employer needs to take their healthcare great benefits people and partner them with the CFO and the CEO and their procurement people, because it's all about math and the quality of your benefits. So when we run it together where we put the healthcare benefits in the C-suite, where it's really about running it by the numbers, then we can shift this and drive down those costs. And there is $1.5 trillion every year. We could get to $2 trillion, but let's be conservative and say $1.5 trillion that can go back into our economy for higher wages, as Suzanne said, and be able to attract more people in this tight job market through the savings through healthcare. And this is a huge win for all of us. And let's see competition unleashed. Unleash the data. Let's see competition unleashed. And all of us will be able to, goodness gracious, just like the airlines, who since 1978, when Carter deregulated the airlines, the prices have come down by half. We all shop here. Yes, travel agents got a new job. The middle players in healthcare can get a new job. And think about Uber using its platform. Gloria, you need an MRI? Put it into a Uber-type platform, tell them you have 48 hours, and let them compete for where you want to get an MRI in the next 48 hours and a 3 Tesla MRI, and you choose. And we can blow it all up, blow up the networks as we know them today. First, it's the employers, but ultimately, it's the consumers right here to control our health care and make the best decisions for our family by protecting not only our health, but our wealth as well. Thank you.